Hey everybody, have you ever woken up first thing in the morning and you can't turn your neck? And you wonder what the heck happened? Did your pillow actually beat you up in the middle of the night? Well, this is termed as traditionally as wry neck. This is very common, and a lot of times it gets misclassified or misdiagnosed as a pinched nerve. And there's many different reasons why wry neck can happen. It's really a subset of symptoms, but one of the most common things is what's called acute facet syndrome. And this happens when the joints in your neck or one of the joints gets really inflamed. Now, because this is such a sensitive area, as soon as there's inflammation in the neck, the muscles go into spasm. Your body tries to protect itself so it doesn't turn, because if you turn, it's going to create a lot of pain. So what are the things that you can do if you wake up feeling this way, or if you check your blind spot and all of a sudden your neck stiffens up on you? Well, the number one thing you want to do is you want to avoid going into the direction of pain. So there's a traditional orthopedic test that checks out for this facet syndrome, and the way we do that is you turn just like you're checking your blind spot, and then you lean your head back. And if you feel it on the same side, that irritation, that's the absolute direction that you want to avoid at all costs. So if you're driving and turning to the right, checking your blind spot is killing you, definitely use your low back. Don't stop checking your blind spot, because then you become a safety on the road, safety hazard. But what I want you to do is just utilize your low back. So you want to avoid going into that motion as much as possible. Second thing is when you stretch away from that motion. So if it's that right side that's bothering you, the way we actually open up those facet joints is by tilting our head in the opposite direction. So a great stretch for this, if it's the right side, bring your arm across and then drop your head down towards your left knee. And what that's going to do is open up those joints and also stretch the muscles around it to get a little bit of relief. Now, the last thing which I would highly recommend is decrease the inflammation. Because this is such a sensitive area and it's loaded with nerves around the area of the joint, you need to get the inflammation down to allow the movement to start happening again and get the spasms down. So you can either use ice or something like arnica, which is a natural anti-inflammatory, but then you can also go to the pharmacy and see what they have for any topical type stuff that will reduce the inflammation in your neck quickly. So once you do that, the best thing you can do from my standpoint is when you come in and see someone like me, you want to do a lot of traction, open up those facet joints with the proper type of adjustments, and that way it's going to alleviate some of the strain, allow for the motion to reset. And instead of it taking about 14 to 21 days for you to feel better, we should literally have you feeling better in about 7 to 10 days where you're almost back to normal. So next time this happens, don't get mad at your pillow, just figure out what you need to do to get better, and you'll be feeling a lot better a lot quicker.